Hello everyone, welcome into the ITS Academy. Myself is Dr. Himani, Senior Research Consultant in ITLS Academy. Today we are going to discuss on stem cell application in regenerative medicine and disease therapeutics. So, first of all, we are going to discuss about the cell. Cell is called structural and fundamental unit of life because body of all the organism is made up of cells. It is functional unit of life because all the functions of body are carried out by cell. By this picture, we can understand atom convert into the molecules, molecule convert in a cell, and a lot of cells make a tissue, and then organ are made with the help of tissue. Then combination of different organ make organ system, and then this organ system convert into the organism. Before we are born and while we are very young, human can repair most tissue damage. After we get older, we can heal wounds and make new skin and blood, but we cannot regrow arm or legs or even finger. So now, beginning of life. As you probably know, we all begin with our lives when a male sperm fertilizes a female egg. A fertilized egg is called zygote. And the zygote begins to divide and divide and divide until all of our cells are in place and our bodies begin to function. So now we are going to discuss of different cell types. Did you know that a human body has about 10 trillion cells? Of course, you know that a human body has different type of cells, but did you know that there are 200 different cell types? Some examples are red blood cells, skeletal muscle cells, nerve cells, and heart muscle cells. So now we are going to discuss about the stem cell. All of these different type of cells develop from one special type of cell called stem cell. Stem cell can become any of the cell type in our body. Like stem cells can be converted into the nervous cells, cardiac cells, muscle cells, interstitial cells, and liver cells. So what is stem cells? What is the actual definition of stem cells? So stem cells are non-specialized cells that has the capacity to become all the different cell types found in the body. Stem cells are the provider of new cells in the tissue and organs of the body. It have ability to replace cells that die daily. They have the capacity to form different type of cells. There are different type of stem cells characterized by the different where they are found and by their capacity of differentiate. Some type are like to form tumor if used for treatment of illness. So now we are going to discuss about the different type of stem cells. Stem cells are divided into the three parts. First one is the totipotent stem cells, and now we are going to discuss about these cells. So totipotent stem cells are the most versatile stem cell type because they are formed shortly after fertilization of an egg cell by a sperm cell. They can become all of the cell of the human body as well as the cells of the embryo and developing fetus. At about 4 days into development, these totipotent cells specialize slightly, becoming pluripotent stem cells. So now the second type of stem cells is embryonic stem cells or pluripotent stem cells. Embryonic stem cells referred to as ES cells, which are derived from pre-implantation embryos, are unique because they are pluripotent. It means that they can develop into all cell and tissue in the body, and they self-renew, identify in their undifferentiated state. Pluripotent stem cells can give rise to all of the cell type that form the human body but are not as versatile as totipotent cell. So, embryonic stem cells are an example of pluripotent stem cells, as are a type of lab-made stem cell called an induced pluripotent stem cells. Induced pluripotent stem cells is the short form of IPS cell. Embryonic stem cells are controversial because they are collected from early stage embryo, even though the embryo only consists of 100 to 200 cells. At this stage, this limits their use. IPS cells are not controversial because they are made from adult cells. IPS cells are differentiated cells that are reprogrammed back into an embryonic-like state. They are usually created from skin or blood cells. Both types of pluripotent stem cells can give rise to nearly all of the tissue that form the human body. So now we are going to discuss about the third type of stem cells is adult stem cells or multipotent stem cell. Adult stem cells are derived from various tissue in the human body because they can branch out into many different cell types. They are referred to as multipotent. Multipotent stem cells usually prefer to become cell of a certain class or category. Like first one is hematopotent stem cells. So now we are going to discuss about these cells. This hematopotent stem cells are type of multipotent stem cells that prefer to become cell of the body and immune system, although it possible to induce them to become other cell types. Second one is mesenchymal stem cell. Mesenchymal stem cells are a type of multipotent stem cells found in bone marrow and fat, among other tissue. These cells tend to turn into bone, fat, muscles, and cartilage cells. Third one is the neural stem cells. Neural stem cells are a type of multipotent stem cells found in the brain. Unsurprisingly, they like to differentiate into neuron, glia, and other similar cells. In short, multipotent stem cells are more specialized in nature than totipotent or pluripotent stem cells. So, scientists are trying to figure out how to get human stem cells to turn on and regenerate limbs and organs. There have been some success in the laboratory and researchers have figured out how to get muscle to regrow in the legs of injured soldiers. Scientists have also been able to grow skin, heart, muscle, liver, kidney, and lung cells. Wonder if could figure out how to regrow nerve bone and heart cells. This ear was grown on a mold in a laboratory. Also, a bladder had been grown to replace ones that no longer work. So, is not this amazing? Yes, this is the amazing thing. So, now we are going to discuss about the regenerative medicines. Regenerative medicine, the most recent and emerging branch of medical science, deal with functional restoration of tissue or organ for the patient suffering from severe injuries or chronic disease. Regenerative medicine has the potential to heal or replace tissue and organ damaged by age, disease, or trauma, as well as normalize defects. So we can define regenerative medicine defined as the process of replacing or regenerating human cell, tissue, or organ to restore or stabilize normal function. We can understand the fundamental of regenerative medicine. In this procedure, we can take first cell, uh, and cells can be isolated from the different organs, and then the isolated cells are manipulated, expanded, and or organ are generated from the reprogrammed cell. Then the modified cells are transplanted into the patient. This is the procedure going on in the regenerative medicine. So now we can understand the cell therapy during the regenerative medicine. Here you can understand it is a in vivo treatment. Regenerative medicine is a in vivo treatment. In this process, cells are isolated from donor or other organism. Then these isolated cells are cultured, further manipulated, and expanded. And then this expanded or cultured stem cells are transplanted into the patient. This is the process which are using in the regenerative medicine. So now what is the regenerative, sorry, so how stem cells therapy work? When stem cells are transplanted into the body and arrive into the injured part, brain begin target for tissue regeneration. The stem cells are coming in contact with growth chemicals like EGFs, NGF, and HGF in the body. These chemicals program the stem cells to differentiate into the tissues surrounding it. So now we are going to discuss about the disease cured by the stem cell therapy. These are spinal cord injuries, diabetes, mellitus, cancer, stroke, tooth implanting, deafness, and blindness and baldness. So now we are going to discuss about the stem cell treatment for spinal cord injury. These stem cells are first collected from a patient bone marrow, extracted from the hip bone, then implanted back into the body later. These re-injected stem cells have the potential to transform into multiplied types of cells and are capable of regenerating damaged tissue. So now we are going to understand stem cell treatment of diabetes mellitus type 1 and type 2. Adult stem cell therapy with autologous stem cell fight type 1 and type 2 diabetes at its root, reducing hyperglycemia. These re-injected stem cells are capable of re-engineered damaged cells such as pancreatic beta cell. So now we are going to discuss about stem cell therapy of cancer. Umbilical cord blood stem cell have been used to treat cancer patients with conditions such as leukemia and lymphoma. The unfortunate side effect of the chemotherapy that the stem cell transplant attempts to reverse. Now, stem cell treatment of baldness. Hair follicles also contain stem cells, and some researchers predict research on these follicle stem cells may lead to success in treating baldness through hair's multiplication, also known as hair cloning. Treatment is expected to work through taking stem cells from existing follicles, multiplying them in culture, and implanting the new follicles into the scalp. So, now the benefits of regenerative medicine. Here, benefits of regenerative medicine we can concluded in the four parts: enhance healing and reduce pain. Sorry. Regenerative medicine focus on addressing the root cause of pain instead of simply managing symptoms. Stem cell therapy do this by delivering growth factor to the injured area to aid the healing of tissue. This allows patient to heal and experience less pain than with traditional medicines. Increase functionality. Regenerative medicines promote the production of collagen in the body, which strengthen tendons and tissues. When the tendons and tissues on and surrounding the joints are strengthened, they increase the range of motion in joints, allowing you to move freely and completely everyday tasks freely again. Now, third one is faster recovery. This is the most important benefit part of regenerative medicine. The growth factor used in regenerative medicine help jumpstart the regenerative process of tissue and tendon, leading to faster healing. This allows you to return to your normal activities sooner. Last one is reduce risk of future injuries and pain. Collagen tighten and strengthen the tendon in the joint, minimize the risk of future injury and pain. So now, ethical consideration of stem cell therapy. As the research method mainly focus on embryonic stem cell, which involve taking tissue from an aborted embryo to get proper material to study. This is typically done just day after conception or between the 5th and 9th week. Since then, researchers have moved on to more ethical study methods, such as include pluripotent stem cells. Pluripotent stem cells is a artificially derived from a non-pluripotent cell, such as stomach, adult somatic cells. Nowadays, stem cells treatment has been spread throughout the world. It has also been grown commercially in developed countries. It is true that one day it may be the major key to treat various diseases. So now, why stem cells could be the medical innovation of this century? The current marketing of stem cell therapies is growing at 36% year, though it will rapidly expand when a breakthrough occurs towards the treatment of a non-communicable disease such as cancer, diabetes, heart disease, or a lifestyle factor. Example like growing hair in the correct places, expanding ability or increase healthy lifespan. Funding is following into the sector from venture capitalized and large companies. And third one is with great resources and increasingly experienced talent pool, scientists and physicians may be able to develop stem cell science to cure the world's most challenging disease. Now, why stem cells and why now? The leading cause of death in 19 were mostly infectious and communicable disease, while the prevalence of most causes has diminished. The largest increase include heart disease, almost 40%, and cancer is almost 300%. Granted, this is a partially due to doubling life expectancy and a lack of death from other causes. However, given time and resources, scientists and physicians may cure the challenging disease. Today, 6 of the 7 leading causes of death are non-communicable disease. It could be a heart disease, stroke, lung disease, cancer, Alzheimer's disease, and diabetes. Based on the early promise mentioned above, regenerative medicines may be our best hope to solve the great non-communicable disease of our time, and perhaps the single most transformative medical innovation in a century. So now, regenerative medicine in 2019. According to Q3 2019 data from the Alliance for Regenerative Medicine, there are 959 regenerative medicines companies worldwide sponsoring and 1052 active clinical trials. 5 to 5 of these companies are in North America, 233 in Europe and Israel, and 166 in Asia. In aggregate, 7.4 million has been invested in regenerative medicine companies in 2019. 5.6 billion of which have been dedicated to gene and gene modified cell therapy, 3.3 billion in cell therapy, and 1.14 million in tissue engineering. So, this was all from my side. Stay safe, stay at home. Thank you so much.